Here are three most common types of balding, so you can tell which type of balding is happening in your scalp. Number one, androgenic alopecia, also the most common type of hair loss affecting 80% of men and 42% of women worldwide. The easiest way to check is to just wash your hair, pick up the hair that falls on the floor, and stick it on the wall with water. If you see that some hairs are far thinner than the others, then you're most likely to have some level of androgenic alopecia. That's because thinning of some hair follicles is a classic sign of androgenic alopecia. Now, you can confirm this by looking at your genetics on either side of the family. So, if your dad or your mom's side, your granddad has no hair, then it's most likely that you have androgenic alopecia. But here's some research that most experts don't discuss. Studies done on 92 male identical twins showed that one of the twins had more hair loss than the other. Now, if we assume that both of them had almost identical hair genes, how did one twin lose more hair than the other? Which brings me to the second type of balding, telogen effluvium. Unlike androgenic alopecia, telogen effluvium is more widespread out around the scalp, which means that you'll see thinning in different areas of the scalp, not just the crown or the temples, like androgenic alopecia. And like the name suggests, telogen effluvium is mainly due to more of your hair follicles going into the telogen phase, as in the phase which they rest and get ready to fall off. Now, this could happen if you're sick, stressed, ill, or have sudden hormonal changes. But luckily, this is almost fully reversible. After a few days of recovering from sickness, reducing stress levels, and eating right, you'll begin to see that some of your hair has started to grow back in the next 3 to 6 months. And we'll get into what are the top 3 foods that help you regrow hair later in this video. But if you're in your 40s, 50s, or 60s, then you'll want to hear about this next type of balding, senescence alopecia. This type of balding has no particular cause except for the fact that we're growing older and our hair is getting thinner. Now listen, the biggest mistake most balding people make is that they immediately start using drugs like Minoxidil and Finasteride instead of actually understanding what type of baldness they're going through. So if you're genetically predisposed to balding, in other terms, you have androgenic alopecia, otherwise known as pattern baldness, then it's all right to start with treatments for your hair, of course, with the consent of your doctor. But if you have telogen effluvium, which is basically baldness caused mainly by poor lifestyle or illness, improve your sleep, diet, and start to exercise first. Your hair will most likely grow back without any of these extra drugs. And having said that, if you've already been diagnosed with pattern baldness and you've seen folks in your family go bald,